Hi, this is Ebony, and I am recording a part 2 to episode 10 on mental health and self-care. And I'm actually here with a psychiatrist, because there were a lot of people that wrote in and had questions that I am not able to answer. And so I'm actually here with my cousin, Camila, who recently finished her residency. Yay!
Right. Thank you.
And is like a legit, full-fledged doctor. And so we're going to have a kind of casual conversation about mental health.
Right.
And so, I'm also here holding her adorable dog. And so there might be a little bit of background noise, but that's all right.
Yeah. Okay. So maybe the first thing, because you brought this up, you're like, are you licensed?
Yeah, I don't know how that, yeah.
So I think one of the big things, especially with people of color, is just like understanding different levels of like mental health providers. Mm-hmm. So one of the big things for me, I'm a psychiatrist, and differentiating between a psychiatrist and a psychologist. Mm-hmm. So I went to medical school. I am a physician. So just from an easy, lazy standpoint, I can prescribe medication, right? Mm-hmm. I have studied medicine and I practice medicine, right? Mm-hmm. So went to med school and then I just completed 4 years of residency. So, so I'm board eligible in psychiatry, which is pretty exciting.
Insert applause.
But I'm also your cousin. Yeah. I was listening to the last episode. I was like, you don't know anyone in your family.
That I've had actual. Yeah.
Maybe okay. I'm not a grown up though.
Yeah,
is that what it is?
Also,
I mean,
yeah.
Like
I think
you didn't see me as a grown up.
Yeah, like my parents, grandparents who had these conversations.
Absolutely.
Yeah. That wasn't a thing.
Also, but I agree. Like we didn't have conversations about mental health, and we just don't, right? Mm-hmm. And then psychologists are PhDs, mm-hmm. right? So they study like theory, and they're usually they do like assessments. But both of us, so this is usually where there is like this unnecessary, and I think a lot of people do, like which ones prescribe meds and mm-hmm. which ones do therapy. Mm-hmm. And we can get a little bit technical and say that like in some states, psychologists, if they get additional training, can prescribe meds, but we all do therapy, right? So although I prescribe medication, I'm also trained in particular in different types of therapeutic modalities. So my training has mostly been psychodynamic and CBT, DBT, specifically treating certain diagnoses, right? And so as well do psychologists. Mm-hmm. So that's a little bit of the difference, that like we're physicians and they're PhDs, but we're all called doctor. Mm-hmm. And so I think a lot of people get confused about that because they're like, do I need to see the talk doctor or the medication doctor?
Yeah.
So, and you can see both.
Yeah.
But generally when people think of medication, they think of us, which I think limits us mm-hmm. as psychiatrists. And unfortunately, sometimes we feed into that we don't do enough talking mm-hmm. and we do too much prescribing. Mm-hmm. But maybe that's my Black people stuff as well. Yeah. Like, that psychologists usually, if they are doing therapy, mm-hmm. are doing specific therapeutic modalities, right?
Yeah.
So,
okay. So all the questions that I have are pretty big.
Okay.
So like you were saying earlier, like, oh, that's kind of loaded. But I had a few people actually kind of DM us and like, how do I know if I have blank? So first, I'd like to ask you what some potential symptoms are of, I guess maybe any common mental health issues or mental disorders, but specifically, I guess, depression and anxiety for people that were specifically concerned about that.
Okay. So one of the things, either within yourself or like if you're thinking of a loved one or a friend or a family member, because I think that often people think that depression is just kind of being tearful and crying a lot, and that can be a symptom of depression, but from kind of a clinical diagnostic standpoint, we look for different criteria, and that's one of them, right? So one of the things that we look for are people who just like subjectively kind of report having a depressed mood most of the time, right? And it can feeling sad, feeling down, and this is really kind of your state of being, right? And that finding joy is something that you struggle with and you have a difficult time with. And then we also look at, and this might, not necessarily be what I would expect someone who is not trained to do this, but what as we can all do for ourselves and for the people that we care about to recognize these things. And also sleep disturbances, so sleeping too much, but also not being able to get to sleep. So laying in bed at night and having so many things on your mind that are worrying you. And I don't mean like you have a big test tomorrow, you can't sleep, I mean just like all the time, this kind of constant insomnia and things that worry you and keep you up at night, or just sleeping too much. We look at energy. So do you feel fatigued all the time? And there's no other explanation. Another thing is that we also want to make sure that, this is one of the benefits of also going to see a psychiatrist, is that medically, because there are medical conditions that can look like depression. And so are you getting regular medical checkups? Do you have lab work done? Because before I diagnose someone who has never been depressed with depression, I'm also going to check certain labs to make sure I'm not missing a medical condition that can explain why they're presenting like this, right? Weight gain, weight loss, sometimes that is not necessarily consistent with appetite, but also loss of appetite and increased appetite, right? So some people, for them, depression is eating a lot. It's not being able to control what they eat. And with some people, it's no appetite at all. You don't want to eat. You have no energy. You want to lay in the bed and not do anything. And then difficulty with concentration or your ability to think, right? So not being able to plan things, not being able to focus, not being able to, concentrate on things that previously you were able to do, right? And then I think another important one, primarily what we do think about too, is like thoughts of death. And it's not always active. So it's not always I want to go in my life. Sometimes it's I wish I didn't wake up in the morning, right? So it's not necessarily the thought that I want to go kill myself, but it's life isn't worth living, or what I'm experiencing is too difficult, that it would be easier not just to wake up. And that was like the difference, kind of what we call like passive and active suicidal ideation. So an active suicidal ideation would be like, I'm making a plan and this is how I'm going to kill myself. And in my life, passive is, if I was in a car accident, that would be fine. And all of those things, though, both represent a certain amount of internal suffering, right? And so sometimes we don't have the insight to call that depression. And that's where a professional comes in. And sometimes it's hard to hear, and sometimes we already know it. We just need someone to tell it to us, right? And the people we care about can see it as well. So like I said, recognizing it in yourself and also in other people. And that from a cultural standpoint, depression might look different. Some people might express their suffering more with physical symptoms, where they feel physically sick, or their anxiety might come out as stomach aches or headaches. And really it's anxiety, right? And really getting down to the core of it. Or that depression isn't necessarily expressed or manifested in sadness, but it looks more like anger, right? So when you can't focus, when you're feeling down, then you're more snappy at people. You're more aggressive. You have a more difficult time controlling your temper, and really, some of it is just being able to be vulnerable, to acknowledge that you don't have to have everything together all the time, and that sometimes it's okay to ask for help.
Okay, well, actually, I do have a question.
Okay.
So, how long should these symptoms persist before you are concerned? So, feeling down for a couple of days versus, and I know that for some people, this is like, it's not sporadic, but like, it happens in spurts. Like, maybe you might be feeling this way this week and then maybe next week, but not every day.
Right.
Like, so at what point is it, I don't know, maybe the difference between like, I'm having these symptoms maybe for a couple of days and then they go away, and maybe every 6 months,
So one of the things to keep in mind, there's different types of depression, right? So like seasonal affective disorder, especially in people who live in like environment, like where there's winter, where the sun is not out, like that is a very real thing that people experience. But premenstrual dysphoric disorder would be another example, that some people really do have a difficult time before their menses comes on. And we can treat that with medication. However, the most important thing is functional impairment. Do you get to the point where it is impacting your life and your relationships? That's when it's time to seek help. That is the difference between I am having a bad day, I am owning that I am in a crappy mood, and I want to lay on my couch and eat ice cream and don't fuck with me, right? Like, and the next day you're fine. We're all allowed to have that. We just are. Like, it happens to the best of us, and I think that owning how we feel and not pretending to be okay is okay. It's okay to be like, you know what? And I think, like what you talked about before, that's what self-care is. That sometimes it is okay to take a step back and be like, I'm just not feeling it today, or I feel down, and owning those emotions, because I think there's an argument to be made that pretending to be okay and not taking care of yourself when you're not might be the thing that fuels depression. Right? Like,
it's also a bigger issue. Yes.
And then you get to a point and you're completely overwhelmed and everything's falling apart and you don't know what to do, because those moments when you should have honored yourself, you didn't. Right? And that is also a real chemical imbalance. So I don't want to minimize it and just say, oh, like, if you take better care, like, no, like, depression is real. It's a chemical imbalance. It can be triggered by stressors, by specific events. But also, it doesn't necessarily have to. And that is one of the, difficulties of dealing with mental illness. So.
Yeah. Okay.
So, just because you have a mental health diagnosis does not mean that you are not, like, accountable for your behaviors, right? Like, depending on the diagnosis, right? And often people are misdiagnosed. So that is some shit that, like, we really, really, I feel like, have to talk about. Like, one, what is your real diagnosis versus what your family says is wrong with you? Versus, like, what some clinician who wrote check marks on a piece of paper and said, oh, okay, you're endorsing all these symptoms, you must have X, Y, and Z, right? And how many misdiagnoses there are. And I have countless stories of, like, people presenting with certain symptoms, and when you actually do a detailed assessment, you realize that, like, oh shit, like, this isn't ADHD, this is fucking trauma, right? Like, or this is whatever, usually trauma. And having people in missing the appreciation of what is a real diagnosis versus what is a symptom, right? So, like, anxiety is a symptom of PTSD. It's also a diagnosis. So, Okay. And people can explain that they're anxious, and people love to self-diagnose, right? And I'm anxious, and this is that thing, and I have X, Y, and Z. And depending on whether they're ready to hear it or not, because people aren't often ready to hear or can be receptive to what you think might be going on with them or to what is really going on with them. And so it's easier to say that I just have anxiety, right? Than to say I have PTSD. Or that I have a personality disorder. Or that I have depression, right? Because even, like, we talk about mental health stigma, but even within mental health, there are certain diagnoses that are stigmatized and certain that are not. So
okay, so...
Like, so, you know, people love to be like, I'm bipolar. You're not bipolar.
Yeah, that's an issue too. Is that there are tons of mental health disorders that get thrown around,
like very colloquially. Yes, like I'm bipolar because I go off on people, because I have an attitude, because like I have mood swings. Maybe you're just an asshole.
Oh man, I think that's gonna be the title. Yeah.
Maybe you have a personality disorder.
Yeah.
Bipolar sounds cute. That gives you an excuse, right? But like there is a very specific set of clinical criteria that I am looking for when people tell me that they are bipolar, they think they're bipolar. A lot of the times they have a personality disorder. Or they lack appropriate coping mechanisms, right? So you don't know how to deal with stresses, so you're mad and you go off on people, right? Because that's what your mama did. Because that's what everyone around you did. Because you cuss people the fuck out when they piss you off. But that shit ain't right? Like, that's not bipolar. And then when I actually, and I take a lot of time to like diagnostically go through what is bipolar, because sometimes people do have bipolar disorder, that it's real, right? And it affects your ability to function normally. And it's debilitating and it's traumatic to yourself and to your family.
Basically, it's just a lot of times it's not what you think it is.
Right.
Yes.
Right. Because we like have our hood diagnosis.
Yeah.
Right.
Yes.
That's okay.
A lot of those,
hood diagnoses are important because a hood doctor recognizes, and this is what I talk about like the competency and the compatibility. Like when you tell me that, I'm like, oh, so you do X, Y, and Z. And it's like, yes, that's exactly what I do. I'm bipolar, right? Like, probably not.
Yeah. I don't know if is it called intake form or whatever? Like a lot of those like pre-screening surveys that they have you fill out are confusing because a lot of times they ask you to check, like, are you, these things. And so, but yes, used to have to like, okay, so I have heard these things, or I have heard that these things are defined in these ways, and so I'm checking these boxes, even though they might not be accurate. And so it's, I don't know. I think it might be more beneficial to have the symptoms kind of listed. It's like, so do you ever feel this way or whatever, as opposed to like, do you have anxiety?
Yeah.
Do you have these things?
Because anxiety means different things for different people.
Right.
So, and there's no easy way to answer that. I think from a professional standpoint, without being too convoluted and overcomplicated, like it's good to have those basic things to make sure you're asking those questions, but it is also lazy, right? Do I expect should you expect your surgeon, versus your family medicine, your pediatrician, your psychiatrist to be asking you certain questions. And it is good for screening and asking additional questions, but you should not be diagnosing from that. I think that what's important for patients is being honest about what you're experiencing. And that's hard because, one, we don't trust people. and we want to present like we have it all together.
Right. And I think too, like you're saying, a lot of times people have been encouraged to go in and talk to someone from other people, and they a lot of times want to suppress those like characteristics that they think have like, prompted other people, and so I think that those are things that could deter someone from going in to see somebody at all. It's like, is this person going to judge me, or this fear that like that ultimately like results in like some kind of paralysis where they don't do anything.
Right.
But I don't know if you want to comment on that, but I had one last question. That like, how do you tell the difference between something that's like your personality and something that is potentially a symptom of something?
Okay. So to address the first thing, there is always a potential to be judged, to feel like you won't be a good fit. I don't ever think that that's a good reason to not be honest. So if you meet with someone for therapy for whatever reason, and there was nothing to lose by being honest, there was a lot to lose by going. But first of all, your time. Second of all, if you're going to be helped and you're not being honest, then you're wasting your own time, right?
So I guess a good question for that, and maybe it could help people that are listening, is like, how do you go about choosing someone? Trial
and error. Every therapist ain't for everybody. and there's something to gain from that experience, right? Like, so I've seen therapists, right? First time in, I'm like, this ain't gonna work. After our first session, I'm like, this isn't gonna work. But some of it is my own training where I'm like, look, I'm comfortable enough now seeing a white male, but we don't have to talk about the fact that you're a white male, right? So now I'm at a point where like I can go in with that. But in the past, I wasn't, right? And I felt like this person has all these biases in the way that they're engaging with me. And what a lot of us do is we say, it doesn't work for me because I had this one experience, right? But it's like, okay, that was one experience. How many girlfriends have you had? How many boyfriends have you had? Did you not date because one relationship didn't work out? Like, eventually, like, you'll meet someone who matches with you, right? Eventually, you'll meet a doctor that when you walk in, you get it. And maybe you don't know when you walk in, you get it. Maybe it takes time. And eventually, like, it's a lot, like, it's a relationship. It's a professional relationship, right? But the beauty of it, though, and this is another thing that, like, so people, a lot of my patients are like, well, I don't need, or not even just patients, friends, I don't need to talk to anyone. And I'm like, no, you actually do. Like, because I have my mom. Your mom is your mom. There was something beautiful about having really someone who is unbiased, who has nothing to gain, that your mama cannot give you, right? And that is like the beauty of mental health care, of self-care, right? Is allowing, because like, I'm just gonna say it, like, maybe some of your hang-ups are with sexual orientation or with religious preferences are actually with your mama, right? Like, you can't talk to your mama about your mama. Yeah. Because she's not trying to hear that shit. Yeah. But it might be very real to you. And something that you really need to talk about. And you can't experience growth and healing until you process it. And so some of it is just, you keep trying. And I think that, a lot of times we do feel more comfortable because of the society we live in, feeling like we can culturally relate to the person. And sometimes we can't. You'd be surprised. Like, just because it's a black woman doesn't mean, but doesn't mean that she can necessarily relate to you, or someone who shares your same religious beliefs. Does that mean they can't be a good provider? Absolutely not. Does that mean that they can't help you? Like, each person, I believe, like, there was something to gain. Maybe starting out, that's helpful, but as you progress, as you develop a greater sense of self-actualization, that as you deal with your depression, your mental health issues, and just all the shit that we all have, right? Because you don't have to go to therapy because you have a mental health diagnosis. Again, I want to reinforce, you should go to therapy because it's like exercising. It's like tutoring. Like, it helps you live a good, well-balanced life. And I realize that, like, some of that is a thing of privilege. Like, I don't know if folks in the hood are just trying to survive, right? They're just trying to eat, just trying to feed their kids and wake up and get to work in the morning and figure out their bus route. But hopefully, just like you can get to the doctor if something is wrong with your blood sugar or your blood pressure, and you can recognize those things, that we're doing better as a society, that we're saying that, okay, you also probably need to go talk to someone about this other stuff. You also need to see a psychiatrist. Maybe you're clinically depressed, and maybe those other things, and that you will have access to providers who actually care, and to be able to get help. So, and again, listen, like, if you feel like your doctor is not listening to you, get another doctor. I don't care if you own Medicaid. I don't care if you went, like, you have the right to be treated well. And you know, you have the right to have your doctor explain to you, and this isn't just for mental health, this is for health in general. Like, don't act like you know what they're talking about if you don't. Don't accept a diagnosis. If they're saying that you're bipolar, schizophrenic, don't accept that shit. Ask them to explain why. Why did you come to that diagnosis? And really, like, self-advocating so that you're not stigmatized, right? And so that you're also not accepting labels that might not be accurate.
Right. And then I think that also, I mean, obviously there are a lot of different issues, like, in the healthcare system more broadly, that make people that kind of discourage people from feeling like they can come in and talk to somebody because it's expensive, right? And so how do you, as a person, know, okay, I need to go in and talk to somebody anyway,
so the easiest answer that I can give you, now this is going to sound loaded, is you can't. Right? Like, so a lot of us are not even aware of who we are or have enough insight into our own experiences to appreciate when we don't need help. So a lot of times, to normalize mental health treatment, I tell my patients everybody needs therapy, period. And one of my go-tos is that, like, I think of, so I'm going to talk very specifically right now about Black folks, okay? So, and maybe poor people too. So, one of the things that I notice is, and I use this analogy of tutoring, is that I think that this is an overgeneralization, but whatever. I think that it's pretty accurate. That a lot of Black people think of tutoring as something that you do when you're failing, right? Like, so if you're a parent and your child needs a tutor, they usually need a tutor because they're struggling, right? I mean, do you agree with that? Like, that's how we think about it. And so it was, like, pretty mind-blowing to me in college. I was like, wait a minute. Like, you get tutoring when you're doing well?
Yeah.
Like, you get tutoring to stay ahead? Yeah. Not because you're failing? And I think of therapy a lot in that way, right? Like, so a lot of my Black patients will come to me and I will bring up the need for therapy or whatever. Or in just people in general. And it's like, well, there's nothing wrong with me and I'm not having any major problems. This is how we deal with marriages. Like, often we don't go to marital counseling until there's a problem. When really, if you go when things are good, that's when the work is done, right? Mm-hmm. Because if you go when there's a problem, you're focused on the problem. Mm-hmm. And that is where all your energy goes. But if you go before there's a problem, you actually are more insightful. Mm-hmm. So, and you're more likely to prevent having a problem in the first place, mm-hmm. right? That's when the real work is done, right? Mm-hmm. That's when there's calm. That's when, at least from the type of therapy that I do, that's when we're the most insightful with who we are and we get the best understanding. But usually we go when there's a problem. Mm-hmm. And so one of the things about if you go and see someone else, if you go and see a professional, if you're depressed, so you don't necessarily have to see a psychiatrist. If you're seeing a counselor, a therapist, they can often recognize it before you can and can refer you to see someone else. So a lot of the patients that I get are coming to me because maybe they've seen someone else or maybe their family has said something. Mm-hmm. And they're like, okay, I'm going to get help. But usually that's when there's a lot of chaos, right? Mm-hmm. And we're waiting until things are really, really bad. But a professional might recognize things before we can, because unfortunately, I think that a lot of our experiences, I think we're so used to suffering that we don't recognize how much suffering we're actually experiencing, right? And that our suffering is not normal, that it really is suffering. And so I don't think, I think it's unreasonable to expect you or anyone, let's say, who has cancer, to recognize all the symptoms of their cancer, right? But you recognize something's wrong, and you go and see a professional, and they do tests, they take lab values, they do pathology, and they make a diagnosis. So it's kind of the same thing, that something isn't right. The problem with, I think, a lot of people of color is that we live with so much that are normal and so abnormal that we minimize our experience and we don't recognize our own suffering and we think we're okay and we're not, right? And the other thing I think that happens is that how we view, like when we think of what depression is, that we think of weakness, and we think of sadness, and we're not allowed to be that. And we got to stop diagnosing ourselves, one. And two, sometimes it ain't sadness, it's anger. That it is your inability to sleep, that it is your inability to engage with the world, that it is just an overall sense of hopelessness and helplessness. And maybe it isn't sadness, that clinically, diagnostically, what I'm looking for, there are multiple things that I'm looking for and not just one thing. What I really want to say is having, like, Black doctors are important, right? Like some of the limitations have nothing to do with us. When you walk in the room and you feel like that person cannot relate to you, that they don't understand you, that shit is important, because the reality is a lot of them cannot. And so some of it is us being present and having networks where we can find providers that look like us, that can relate to us. Now, some of it might not be true. It might be an assumption that we're making, but to be in this, it's one thing to have cultural competency training. It's another thing to be like, I understand.
I lived it.
Yeah. Like, you don't have to tell me. I remember when my friend got killed in high school. I remember what that shit feels like. I know what it's like when my auntie is smoking dope. Or my drunk uncle, or all of that shit. That is a real experience for me. Now, you don't necessarily know that, but I think that the genuineness of that comes through, right?
Okay, so leading from what you just said to something that you said earlier, which is that we normalize a lot of our experiences. And I think, and also where you started, which is that you're going to speak directly to Black people and probably poor people, kind of generally. So my, non-professional, non-psychiatrist kind of evaluation of like the hood and like, growing up where I grew. So growing up in Compton and seeing, just craziness, right? Is that because everybody's seeing that same craziness, and because a lot of people are projecting in the same ways, we think that, oh yeah, we experienced that and we're fine. And so I think that for a lot of people, the question of like how and so you said earlier that you don't know, but how do we get more poor people, more Black people in to see and talk to people and recognize that seeing that stuff was not okay. Experiencing that was not okay. Like, you may think that you coped, you may think that you're past it, but it's still a lot of the stuff that you're dealing with now. It could be manifesting in a lot of different ways that you're unaware of.
Absolutely.
Like, and how do we?
Well, we have conversations like this.
Yeah. Okay. So yay for us.
And like I said, and more of us have to be committed to helping ourselves, right? Like, to whom much is given, much is expected, right? So we have to be willing to give back and to work within our own communities. Mm-hmm. So it's that, but also we have to be honest, like, with our families, because I think that, and so I see this in a lot of Black and Latino families, that like a lot of people who generally wouldn't come in because their family members are like, yo, you are not okay. Mm-hmm. And so it might be like your auntie coming in and being like, you gonna come see somebody, right? Like, or your mother bringing you in and being like, I don't know what's going on, but something is not right, right? And really being willing to allow yourself to be vulnerable to a point where you can ask for help. Mm-hmm. That you, like, the reality is we don't have our shit together, right? Like, when you think you do, like, you don't have it together, and you can't handle everything on your own. Which is why I said, like, your stuff shows up. Maybe not, you're not some person crying in the corner, but you're fucking angry all the time, right? Mm-hmm. And I mean, I see this so much. It's tragic, right? Mm-hmm. And the things, and I often have to tell my patients, like, the stuff you don't want to talk about, that's the stuff you need to talk about. Mm-hmm. That stuff that's too painful, that's actually why you're at work cussing everybody out, right? Mm-hmm. Why you're getting reported, why you can't keep a job, why you can't have healthy relationships.
Mm-hmm. Anecdotally, right? So I know a lot of adults that had, like, friends, family that had really rough childhoods, right? Mm-hmm. But their perception is that everybody has rough childhoods, and that as an adult, at this point in their life, they have gotten past it, or they've dealt with it, or they've coped with it, and that's that. It's not affecting them. So not the stuff that's like, okay, these are visible changes in your mood, your behavior, the way that you're talking to people, but things that have kind of been there your whole life.
So you're talking more. Oh, great thing. Mm-hmm. You're talking more about, like, childhood trauma, right? Which is the shit that lives with you. Mm-hmm. And from, like, developmentally, from, like, a psychological standpoint, like, the core of who you are as an individual and what all your defenses are based in. Mm-hmm. And this is what I'll say. What we know is... Okay, so this is what I suggest everyone does, right? Mm-hmm. So when I do my clinical assessments, I actually have my patients do this because I think that as physicians, we miss this, and patients don't appreciate it, right? Mm-hmm. So there's something called the ACE study. Have you heard of the ACE study? Mm-hmm. And it's adverse childhood experience, right? And so there's this set of questions. I think it's like 10 questions, and you can look it up. You can Google the shit, right? Mm-hmm. And it's actually on the CDC website, and all of this research has been done. So forgive me, I don't know like the specific clinicians who did this, but it's this really powerful like study that needed to be done, but needed to be actually peer-reviewed science. And there's so much research that has come out of this that is kind of reinforcing what we already know. So a study is a set of questions that's like, as a child, have you experienced like different things? So like a parent with a mental health issue, right? Mm-hmm. With a mental health diagnosis. Have you witnessed domestic violence? Mm-hmm. Have you experienced any form of child abuse, neglect, things like that, right? And you answer these questions, and based on your score, there are different predictors of what your health outcomes will be. And so like we might think like, oh yeah, that makes sense. If your parent committed suicide and went to prison and you were abused and your mother was on drugs, you're going to have issues, right? Mm-hmm. And that, like, you might have that's what we would think, but it's not just that. It's like, no, actually, you're more likely to be obese. You're more likely to have diabetes. Like, there are all these health outcomes. You're more likely to have certain cancers that are directly correlated to how high your ACE score is, right? And it also will affect your children. And so really unpacking, like, childhood trauma is so important, not just for your mental health, but also for your physical health, because like you feel good, you like physically you're better, right? You're healthy.
Yeah. So you like, probably practice healthier behaviors and habits and stuff like that.
And how many people like
so crazy.
And all of this stuff is connected. And I think what happened is this was like some family physicians. So it wasn't even psychiatrists who did this. Mm-hmm. It's family medicine doctors from Kaiser San Diego that noticed. So this was probably a very psychodynamically oriented family practitioner who was like, I noticed that like a lot of my women patients who were molested are also obese. Mm-hmm. And they noticed that there were certain patterns that they were seeing in their patients and medical diagnoses that were associated with these childhood experiences. Mm-hmm. And so really dealing with those childhood experiences, and again, and depression, substance abuse, and so substance abuse is one of those things too, like substance abuse, and how all of these things are interconnected, really appreciating like what you went through as a child and what you've been unable to process or unable to deal with is manifesting in your adult self in ways that you're not even aware of, right? Because a lot of it is unconscious, and the beauty of the brain is that, of the human mind, is that like it protects us, but it also harms us, right? So some things you don't remember from a conscious standpoint, but again, like I said, but your behaviors are indicative of this past trauma. And I'm telling you, Black people have a lot of trauma. And it's beautiful in some ways in that we are resilient and we can thrive in ways that other people cannot. But it's also traumatic in that it prevents us from experiencing happiness and joy and love and being able to be affectionate to our children. And I mean, and from a deeper, like from a more historical standpoint, like we can argue that living in America and experiencing starting from slavery. And even if you think about what's going on right now, because I've this is what this whole these immigration facilities, and we see how traumatizing this is for these children. And if you think of like children being snatched away from their parents, and so that experience is probably similar. What's probably dissimilar is that hopefully we'll get it right, and it won't, and we're recognizing it, and that that shit was normal.
Yeah, and we recognize
for generations.
Yeah, or at least not everybody, but there is a lot of people that recognize that this is flawed.
Yeah, right. Yeah. And that, and I guess I mean that for Black people, that like this was our ancestors' experiences, and then like how many people are like, my grandmother is not affectionate, and she talks about her mother not being affectionate. like, what is that rooted in, right? When that's so important to children, just being hugged and loved, and being able to really think about, like, how much of our shit is from generations of trauma, of childhood trauma, that we're not even conscious of, that we're still giving to our own children. And then you add into that, like structural violence and institutional racism and the things that destroy families. And it's like, fuck, we're doing pretty good. We're doing pretty good. Yeah. We should be really messed up.
Yeah.
So I think to answer the question about how do you tell whether or not this is like just my personality or I'm having real symptoms, is to, one, recognize that personality disorders are actually are within the DSM-5 criteria, and that there are things that can be treated, right? But I don't think that's necessarily what you're asking me. What I think it can be, because I think we have a lot of people with undiagnosed personality disorders or coping or lack of coping mechanisms that are consistent with certain personality disorders. But again, I think it feeds back into the functional impairment. Like, does it affect your relationships so much? And does it affect your overall sense of self and well-being and how people engage with you? And if so, then you need to go seek help for that. Now, personality disorders might be the difference, or just personality characteristics, right? Is probably more so the realm of like therapy, like different types of talk therapy, than it is necessarily medication, right? And sometimes the medication can help, but really like going into therapy and getting insight into why, or learning different ways of communicating, of dealing with people, of just being, so that your overall quality of life and your wellness is just better. So, yeah.
Okay. So that's it for this episode. Thanks so much for listening. Again, this was a extension of episode 10 on mental health and self-care. So I hope that this was helpful. If you have any questions or comments, you know where to find us. We're on Instagram, we have Gmail, we're on Twitter. Stay tuned for our episode next week, where Zelma and I will be discussing media and the promotions of violence. Bye.